My name is Kathleen Lisson, and this presentation is titled Incorporating Manual Lymphatic Drainage into Your Holistic Massage Practice. And I'd like to start by thanking Alternative Balance for hosting this exciting webinar for us and providing us the forum to communicate and talk to one another and get this information out. So who am I? I'm a lymphedema therapist. I was trained by Close Training. I'm a board certified massage therapist, and I also have approved provider status, which means I teach continuing education to other massage therapists, and I'll have an exciting free CE class to share with you that I invite you to take towards the end of the presentation. And I'm also author of a book, Stress Reduction for Lymphedema. So I help people in my office in San Diego after their cancer diagnosis. I'm also trained as an oncology massage therapist and help them with lymphedema as well. So the objectives of today are to list and describe the 4 functions of the lymphatic system. We're also going to discuss why the lymphatic system may play a role in cardiac and metabolic diseases. This is more recent research that I'm really excited to see how, as more research comes out on this. And then list and describe how our lymphatic and nervous systems interact. And this is a big part of being a holistic massage therapist, is that you know how systems interact because you're helping the entire person, not just one part of their body. So I always like to start my presentations with a mindful moment. So I'll invite you to take a position that's respectful yet comfortable. And you can leave your eyes open, softly focused, or you can close them. And I'll just invite you to take a few nourishing breaths. And as we begin this presentation, you've kind of just met me and seen a little bit about what the objectives of what I want to talk about today is. And I'd like to invite you to bring to mind why you came here today. What interests you about this presentation? What you might want to get out of this presentation? And just one more comfortable breath before we dive into all this science information. All right, so if your eyes were closed, open them up, and you can wiggle your fingers and your toes, kind of come back into the present moment, because we're about to get all sciencey. So this is an email that I received from a client. Like I said before, I may have not said specifically, I help people after cancer, and I have a doctor that refers to me, a surgeon that refers his clients to me after they get their reconstructive surgery. So this would be a person who had breast cancer, and then they had the mastectomy, and then they're coming for reconstructive surgery of the breast, and the surgeon is using liposuction to take fat from their stomach and other parts of their body to remake their breast. So I come in about a week after the surgery. The client comes to visit me, and I give them manual lymphatic drainage to reduce the swelling in the areas that they've had liposuction in. And this is a comment that I received via email, because I email all of my clients the next morning and say, hey, how do you feel? And she said this, she had the massage from me and she ended up sleeping a full night and even more than a full night. And that is such an amazing email to get, because sleep is so hard for most of us to get. Sleep is hard you can't just do something quick and fix someone's sleep. Like sleeplessness is a widespread problem, and even more so after the cancer diagnosis, the cancer treatment, and after the second, and hopefully last surgery that she would have. So it's such a gift to get this email the next day that not only, does she feel better from the massage, but that we also got her to have that nourishing night of sleep. So this is the first idea that I can invite you to take your pen and your pad of paper, if you have one nearby, and think for a moment. I'll give us just 2 or 3 breaths. Think for a moment, what have your clients told you about their experience after their MLD sessions? And this is really great information to share on your social media. If you've gone ahead and emailed clients, or they've contacted you or told you, at their second session, this is what happened to me after my last session. So we'll just take a few breaths and kind of bring to mind what of our clients. Okay, got that information. I think if one of our listeners can mute, that would be awesome. So let's dive into what science tells us. So what is MLD? According to the book, Diseases of Lymphatics, Manual Lymphatic, or this is a book. Manual lymphatic drainage is a specific form of lymphatic massage. It's performed by trained therapists, and we're directing lymphs away from congested areas through collateral routes, through to the normally draining lymphatic basins. So that's just the basic definition, just giving us some basic definitions. So that's what I'm talking about when I'm talking about manual lymphatic drainage. And there's a lot of, this might not necessarily be what your clients think it is. And this was just, I had a client yesterday, and she walked into the office and she said, what is this massage? I don't know about it. And she'd heard through social media that it was, like a very deep friction digging massage that she feared would be painful. So I'm altogether too happy to show them exactly what manual lymphatic drainage looks like, and excited to tell them that it's not painful, and that they're going to get really some deep relaxation from the treatment. So why is everyone talking about the lymphatic system? I don't even remember learning about it. And what we can see from the research is that lymphatic biology has shown that lymphatic vessels are key players in maintaining health through their functional roles in tissue fluid homeostasis, immunosurveillance, lipid metabolism, and inflammation control. This is super exciting to me. And their conclusion is that it's not surprising that the list of human diseases associated with lymphatic malfunctions has grown larger. So it's not just to treat lymphedema anymore. So what is the lymphatic system itself? The lymphatic system is an extensive network of interconnected vascular network, and it has starts from blind-ended capillaries into vessels, and then larger collecting lymphatic vessels. So this is basically what the lymphatic system is. Just some basic stuff to get us started. So what is the role of the lymphatic system? Lymphatic vessels have long been recognized to function transporting interstitial fluid from the tissue to the lymph node into the venous system via the thoracic duct right here. So that's what we traditionally know it as. It's a system that gets fluid from one area of the body back into the general circulation. So if there's too much fluid in the body, the bladder can eliminate it. So in addition to moving fluid, it's also moving lipids, so fat cells. It's also moving proteins, and it's also responsible for antigen and immune cell transport. And this is also really interesting. Again, the recent research shows us, and I won't read it, I'll let you read it, because of the additional things that the lymphatic system transports, it can also play a role in metabolic diseases. So strategies that support the lymphatic system can be useful in the treatment of these diseases. And then again, because we're focusing on the holistic therapist, what is the definition of holistic? We're looking at the whole person, the multiple systems of the person, the interaction of those systems. And then this is a great second time to take a moment with a pen and pad of paper and ask ourselves just for a moment, do we have a holistic massage practice? And I love this graphic because it's, for me, the holistic massage practice is the person coming to us because they're looking for a balance that comes from having balance in the body, the spirit, and the soul. And this would be a really great if you're on social media and you're looking for ideas to post, like just having a conversation, posting your thoughts on social media about what your idea and what your definition of your holistic massage practice is. What makes your massage practice holistic? So now I'll bring us to a question that I want to answer several different ways. So we'll keep on coming back to this question. But the key question I ask myself is, why do I want to focus on the whole client instead of just applying a massage technique to like a swollen abdomen or a sore neck? And the first reason why I want to focus on the whole client is because of this great and very busy graphic that we see of our lymphatic and nervous system. And that is, we see the parasympathetic nervous system and what happens when we as a person are relaxed, are in that rest and digest part of our nervous system. We're able to decrease our heart rate. We're stimulating the digestive activity. We are relaxing the rectum, which allows us to efficiently eliminate. And so we're digesting efficiently, we're eliminating efficiently, stimulating the gallbladder, which helps with digestion, stimulating the salivation, which starts with the beginning of digestion. And digestion is such an issue for so many people. Understanding the link between being in the sympathetic fight or flight nervous system and the effects it has on the digestion are super important. And it's further evidence that it's beneficial for us to see the person as a whole person, because not only do we see traditionally that the parasympathetic nervous system affects digestion, but we're also seeing, if you look at the research I've quoted for you on the right, that the sympathetic system impacts our lymphatic system. So the body's sympathetic nervous system innervates our lymphatic system and many of the lymphoid organs. And that is important because when we're in fight or flight, it's not just affecting the pupils and the digestion, it's also affecting potentially our body's lymphatic system. And we see in the bottom quote, the parasympathetic nervous system has that anti-inflammatory effect on our body. And then this graphic this is actually the graphic of a cancer cell. So this is what a cancer cell looks like. And the science have seen that inflammation can trigger stimuli that affects the structure of the lymphatic vessels, and that also chronic stress can have an effect on how fast that the tumor cells grow. So this is very, very important to our clients that are oncology massage clients, that are lymphedema clients like I take. And anybody who has a cancer history in their family will be very interested to learn information like this and be able to understand how chronic stress and inflammation are affecting their lymphatic vessels and potentially affecting their body's ability to fight off tumors. So here's our wonderful friendly question again. Why do we want to apply our technique, our holistic massage to the whole client instead of just doing a spot treatment to somebody? And we can also talk about the lymphatic and the pulmonary system. So there's a localized lymphatic drainage system that serves the body's diaphragm. So this is all about the breathing and how breathing interacts with the lymphatic system. So we see that there's a lymphatic drainage system, and it absorbs fluid from the peritoneal cavity. So the peritoneum is the tissue that lines the abdominal walls. It covers the abdominal organs. And by moving our diaphragm through that diaphragmatic breathing, through breath work, we are going to help our body's lymphatic system absorb the fluid from the peritoneal cavity, and it puts it into our body's vascular system. And more about our core and the diaphragm and the importance of the diaphragm in lymphatic drainage. Over half of the body's lymph nodes are underneath the diaphragm. And that makes sense because our intestines are where we actually process the food we take. And our lymphatic system helps in digestion to get some of those nutrients and bring them to the liver. And when our diaphragm expands and contracts to facilitate breathing, the lymph nodes that are underneath the diaphragm are also moved, and they're pulling lymphatic fluid through the system through diaphragmatic breathing. That's why if you're trained as a lymphedema therapist, the beginning of all of our lymphedema sessions is deep breathing and then compressions on the diaphragm, that deep abdominal technique that we learn. So our wonderful question again, why do we want to focus on the whole client instead of just applying a massage technique to a swollen abdomen or just their sore neck? And this is my own opinion. This is my own, what I've come to in my own practice. So I work with clients using plastic surgery as part of their healthy lifestyle. So the clients that I want to attract on my table have a healthy lifestyle, and plastic surgery is one way that they're helping to care for themselves, whether it's a tummy tuck, whether it's a breast reduction, an explant, the explant surgery. I just had an explant client yesterday. And when I focus on helping the clients holistically, I am attracting less plastic surgery clients that had too much surgery or went to a chop shop or are going to underinvest in their aftercare. So it's really the people that I want to attract to my table are attracted to my table and to my practice because of how I put myself out there on social media, my whole theory towards massage as a holistic massage therapist. And plastic surgeons, they refer clients to me after breast surgery, including breast lift, explant, mastectomy, reconstruction, and also after body lift, after facelift, after lipedema surgery, liposuction and fat transfer surgery, and after tummy tuck. And the women that come to me, and it's people of all genders, but primarily women, these women care about their overall health and not just the results that they can post on Instagram. So why do I want to focus on the whole client instead of just applying that massage technique? And for me, it's finding the right clients. finding the clients who are going to be on my massage table as part of their healthy lifestyle and healing from their surgery, their journey through surgery, and not just because they want to lie on the table and get a shortcut. And the great thing about being a holistic massage therapist, which we'll see more when I get into the interview with my fellow holistic massage therapists that practice manual lymphatic drainage, is that we don't have to go out of our scope of practice, because we're actually excited to give referrals out to other professionals because we're getting referrals in from those professionals. So let's go to this next super exciting part of my presentation. Let's hear from some fellow MLD therapists who have holistic practices. So I reached out to my network and I said, hey, I'm doing this presentation for Alternative Balance. If you'd like to answer some questions and share your wisdom with me, please get back to me. And here are the people, my friends, that replied. And you can see a lot are from America, from Texas, from Kentucky, from South Carolina, from Ohio, from California. But I also found therapists who were willing to help us from all around the world, from Ireland, from the UK, from New Zealand. So we really have a little bit of a worldwide perspective from holistic massage therapists from all different parts of the world. So I asked them, what makes your practice holistic? And the consensus is that it's about considering the whole person and their lifestyle. One of the therapists said, holistic massage means helping the body to heal from the inside out. And this quote, I love this quote so much. Fiona says, my practice seeks to walk alongside the client, supporting them body, mind, and spirit, as many have chronic conditions. So several therapists shared with me that they have experience in multiple modalities, including energy work, and that they share information on stress reduction, nutrition, hydration, and self-care practices. One person, Sabrina, she said she offers mobile massage in the comfort of the client's home, and that's really her unique selling proposition, that she will take this holistic massage experience to your home. Bailey really focuses on intakes. Her intakes take at least 15 minutes and sometimes well over an hour, because she focuses on finding the root cause and many different accessible ways to incorporate self-care. So it's not just about the hands-on treatment, it's also about the client's self-care. And Tammy promotes breath work and mindfulness, being in the now. And she, when she talks to her clients, she'll tell them about podcasts and books that she found helpful, powerful, and pertinent to the patient and the client. So how does manual lymphatic drainage fit into a holistic practice? Alice says, MLD is a gentle modality which promotes the body's natural ability to begin healing within by eliminating what no longer serves the body. And that's an amazing way to explain manual lymphatic drainage to somebody. And it's very interesting, especially I feel like maybe before, like 10 years ago, it was really like, I want a karate chop on the back, like deep tissue, deep massages were what people felt like they needed to get their money's worth out of a massage. But Alessandra's clients see MLD as a valid alternative to massage for relaxation. And a lot of her clients add a face technique, a face time in their massage to the regular massage sessions, because in Houston, there's a lot of allergies. And I have a client who has a lot of allergies here in San Diego. And I feel like she's coming to me a little bit more often than maybe she would for just her post-surgery MLD needs, because she's finding such benefits in that MLD face technique to reduce her allergies. And Bailey has found MLD to be incredibly beneficial for calming the nervous system. And I think particularly in the last 3 years, we're a lot more focused on how is our nervous system interacting with the world that we have right now. And Sherry has a great quote: MLD assists one of the major systems of the body, restoring balance back to the body. We assist a function of the body to do what it was originally designed to do. And I love that, because it's we're not pushing the body, we're assisting, we're helping it do what it's naturally doing. We're, holding the lymphatic system. So this is inspired by all the explanations that we've just heard. This is another opportunity for us to take pen and paper and think about, for a few breaths, how do we explain MLD to our clients? And this is a great part of a potential post on social media, whether you're going to write it and put it in a graphic, or just put your face up to the camera and really tell the people, what is your explanation of MLD for your clients? So we'll take a few breaths here. All right, wonderful. Then we'll move on to how we're using MLD. So how have we used MLD to help our clients? So this is the big four that I heard over and over again. MLD is used to help people with lymphedema, with lipedema, with venous edema, and post-surgically. But that's not all. In interviewing with the different therapists that I talk to, some clients come to them because they want to detox. Some clients come and they find MLD helpful with anxiety, with arthritis, autoimmune issues, bloating, cancer during cancer treatment, if they have cellulite, if they have chronic regional pain, cyclic idiopathic syndrome, if they have digestive issues, if they get headaches, if they have IVF. And I have a client that comes to me twice a month. She's going through her egg donation journey right now in her IVF. And she finds that her swelling is much reduced when she gets regular MLD treatments. With liver cirrhosis, with edema, if they have pregnancy, manual lymphatic drainage is an excellent type of massage. Sinus issues, if they have skin issues, if they have sleep issues, thinking about at the beginning of the presentation, the email I got from my client. If they have sports injuries, that was actually the very first time I got manual lymphatic drainage, was after an ankle sprain. And if they have stress, and if the traditional one, if they have swelling, but it's so much more than swelling, that people are coming to us and enjoying manual lymphatic drainage as part of their self-care. So which clients can benefit from MLD? And this is a really interesting quote. I'll let you read it. And it's from a very interesting person, because Stanley Roxon is from Stanford University, and he's trained in cardiology. He's not a massage therapist or someone who is a lymphedema therapist. And he is studying the data and finding out how many different conditions in the body are affected by the lymphatic system and lymphatic dysfunction. The number of human diseases or disorders associated with lymphatic defects has increased, and inflammatory bowel diseases, eye diseases, neurological disorders, obesity, and cardiovascular diseases are now included. And this is from a published research paper. I feel like maybe 10 years ago, it was like, oh, like, what's the connection between the lymphatic system and all these other diseases? And now the scientists are publishing research that is showing these connections. Then Angeli and Lim say these new findings imply that restoring optimal lymphatic function may now be a promising non-conventional strategy to manage these diseases. So let's move into a little bit of the marketing. So I've shared a couple of potential post ideas for you. I'm very excited and strong into us being able to share our knowledge and share our gifts with the world through social media. So now let's work a little bit into how can we get referrals. And I asked our 10 holistic massage therapists from around the world, how do they get referrals? Because referrals are important to our massage practices. How do we find new clients? Alessandra says, happy clients are the best advocates. So she sends her happy clients back to their surgeon or doctor, and she has a brochure that illustrates her education and the benefits of MLD, and she sends them with the cards as well. Bailey focuses on educating clients and empowering them to be their own advocates. She arms them with information to take to their primary care physician and health team. Natalie shares that some of her clients come to her because the doctor or chiropractor recommended MLD, and she speaks with the professionals in person and shows them before and after pictures. And the concept of bringing colleagues together can also encourage referrals. Alessandra is going to build a bigger office so she can offer, and rent space out to an esthetician, a nutrition or wellness coach, and possibly a counselor. And that was a little bit of how I got my start the first time I had my own room. All to myself that I rented out. It was in an office that also had an acupuncturist, it had a mental health professional, it had an electrolysis professional, and a colon hydrotherapist. So if you're new or you're potentially looking at moving into spaces and you're looking for like a potentially ready-made referral source, look for a building that has people from several different modalities that may be interested in referring clients to you. And it was great because at this office I was at, there was a general front desk area, and the person who was the massage therapist that rented rooms out to all of us said everyone can put their information and their brochures on the front desk. So even if a client was coming in for electrolysis, she would be waiting in the waiting room and she would be seeing information from the acupuncturist, from the colon hydrotherapist, from the massage therapist that were there. So ongoing education is also important. Alice continues her studies, and she brings up a very good point. She's sitting among the industry's respected experts. She's attending conferences with people who are potentially referral sources. She's volunteering her services in the community. And one of my most important ways that I got referrals for ongoing lymphedema therapy from other lymphedema therapists that worked at hospitals was by meeting them at the educational events that were targeted towards lymphedema therapists. So there is a great educational opportunity called lymphedema seminars, and they would go around to communities in Southern California and hold their seminar. And once it was in Palm Springs, and once it was in San Diego, and once it was outside of LA, and you're in the room seated right next to lymphedema therapists from your area, so you can interact with them and say, hey, I'm a massage therapist, I know how to treat ongoing lymphedema because I'm also a lymphedema therapist. And if your clients no longer qualify for your services because their insurance has run out and they want a cash pay alternative, here's my card, you can give them my card. And they know you because you're sitting next to them at the same continuing education event. So they understand that you're just as committed to advanced education as they are. After 10 years, Justine has earned a reputation. She has referrals from other therapists as well as consultants and surgeons. And she said word of mouth and MLD UK, so that she's in the UK and this is an organization of therapists in the UK, are how she's so busy. And she also wants to use media to educate people. And also we had a member that's a member of MLD Ireland, which is the National Association for Registered Lymphedema Therapists in Ireland. And that's used by clinicians for referrals when you're in the UK and Ireland. So getting onto those lists would be a great referral opportunity. And I have noticed locally here in San Diego, which is a very large city, I've noticed that people on a locally based Facebook group, so it would be a Facebook group for women in San Diego, are regularly asking for recommendations, including recommendations for lymphatic massage. So if you're not already a member of these local Facebook groups to your community, I definitely recommend that you get on and join your local Facebook group. And then you can, when someone's asking, where can I find an acupuncturist? Where can I find a lymphatic massage therapist? You can share out the referrals that you would give to your clients and then share yourself as a referral source as well. So here is, I'll invite you, if you have a phone, to go ahead and open up your camera and grab this QR code. And if you're not able to get it today, this video will be recorded so you can get it next time. This is a reel from one of my colleagues, and they're showing you how they use resources, specifically this book, Stress Reduction for Lymphedema, to send to the surgeons that they want lymphedema referrals for, the therapists that they want to refer the lymphedema clients to them, saying, hey, this is, I have a holistic mindset in the office. This is a book that we offer to clients. And it's really great. What she does is she takes her business card that is printed onto a sticker, and she puts it right in the inside of the book. And so they have that book for their library. And then they also know exactly where to get a hold of her, because all they have to do is pull the book out from the library and boom, there's her business card that they can refer to their clients. So giving your referral source some source of information that's valuable to you, sharing something that would be also interest them and be valuable to them, can help build that trust relationship with your referral sources. So let's look at the bottom line. What did I learn from these interviews? Holistically focused therapists have a high amount of training. We focus on continuing education, and we're curious about the benefits of massage modalities that we use in our practice. Like, we're always learning, we're always able to give. I can go into like amazing amount of detail about the lymphatic system because I'm so excited about it. And we have an hour for our massage session. So I'll ask the client, do you want just the quick version, or do you really want to geek out on me about your lymphatic system? And usually most of the times they're like, yeah, let's geek out together. I'm really interested in learning about this. Holistically focused therapists go in depth, both in learning and in educating their clients about the possible causes, and also self-care for their client well-being. So it's giving them resources to improve their self-care in between your visits. And there's a value in a quality intake process. It builds trust and can show the client your level of expertise because you're asking them questions that maybe they haven't been asked before. And that will get their thinking cap on, really, to see these potential connections between different things that are happening in their life. Holistic therapists are using manual lymphatic drainage's effects on the nervous system, and they're layering on education about other stress management practices like breath work and meditation. And then finally, networking, bringing together like-minded colleagues can increase your referrals and bring new clients to your practice. That's in a nutshell, this is what I learned from speaking to all of my colleagues. So where can we follow all these fantastic therapists? Because they have so much wisdom, and we can kind of see how they, as holistic massage therapists that use MLD, how they do their social media. So this is a great slide to take a picture of. And if you're on Instagram, go ahead and follow them, and follow the one that's on Facebook, because they're a great resource and a source of inspiration. Okay, so now is my gift to you. I invite you to take my free continuing education class. So this is titled Manual Lymphatic Drainage, More Than Edema Reduction. And we're going to, in this class, it's not technique, it's not hands-on, we're focusing on the research. So we're looking at the results of several research studies on the effects of manual lymphatic drainage on emotional function, on inflammatory markers, on pain, on quality of life, and on stress in a variety of populations. So I'm hoping that by the end of this continuing education class, you're going to better understand the effects of MLD on the body and the possible mechanisms of action behind these effects, because that's what the surgeon, that's what the person who's referring clients to you is going to ask. Like, why do you think MLD does this? And not only can you share what you've seen in the research, you can print out the research that I share in this class, and then you can briefly be able to verbally tell them, this is, you know, what we think the mechanism of action is, why MLD is causing these great benefits for the body over and above the traditional of swelling reduction. So you can sign up for my class at this email, at this web address. And then if you can't grab this web address, it's definitely on my Instagram, or you can text me on Instagram, but definitely take a picture of this. And so what will happen is go ahead and sign up. All you do is put your email address in and make up a password, and then you're onto the class's website, and go ahead and take the class, take the quiz. And once you're finished with the quiz, email me, and I will email you your certificate. And I'm a NCTIMBA approved provider, so you'll get that continuing education credit from NCTIMBA, which potentially will help you when you have to recertify and get continuing education. All right, so that was a lot of information that we covered. So I like to end the presentation with a mindful moment as well. So I'll invite you to once again take a respectful to yourself yet comfortable position. You can close your eyes, or you can give a soft focus to my beautiful graphic that my graphic designer made. And I'll invite you to just take a few nourishing breaths. And bring to mind your intention that you had when you first came to this webinar. What were you looking to learn? We saw a lot of information about the lymphatic system, some published research that we can dive further into. I'll share that slide with how you can look at the research in a moment. We learned from our fellow holistic massage therapists on how they market their practice, how they get referrals, how they share these practices with their clients. If this is your passion, if this what brings you to work every day, if this is why you're on the earth, is to help people holistically. I hope that this presentation has given you some wisdom and some ideas and some confidence to share the stress reduction practices, to share the breath work, to share the other stress and self-care practices that you've seen work for your clients, that you've seen work for you with the clients that you have today, tomorrow, the rest of the year. And let's take one last nourishing breath together. And then here are the resources, and most of them have the websites with them, so you can go ahead and Google all these. You can do a web search on all these published research, and print them out and read them and have them on hand, so you can share this information with the people who want to give you referrals, and with your clients that are also geeking out on the increasing role of the lymphatic system in our bodies. And I'd like to end by thanking everyone for your time. You can follow me on Instagram at Stress Reduction for Lymphedema, and also my name at Kathleen Lisson, also on Instagram. And my website, KathleenHelenLisson.com, has recordings of my other presentations, and it also has the link to this free class and another free class on meditation that has CE from Niktimba. And it will also have the PowerPoint slide deck from today. If you scroll down on the website, you can find it, as well as the other PowerPoint slide decks for my other presentations. So you'll be able to grab all the information if you haven't grabbed it on your phone at that website, KathleenHelenLisson.com. And that's my presentation. Thank you so much.
That was great, Kathleen. Thank you. It's
Thank
really
you.
fascinating stuff. Do we want to open up to maybe some questions?
Yes, if we have some questions, let me know. I see a lot of thank yous, and I see there's a link to the slides. So if you go, Sharon, if you go to my website, KathleenHelenLisson.com, you can see that QR code. Yes, and an explant, Sabrina, explant is something that removes the breast implant. Several people are experiencing symptoms, which may be like breast implant syndrome, negative symptoms that they think are linked to having their breast implants and their body's reaction to the implant. So there's a local surgeon in San Diego, Dr. Swiston, that will remove the implant, and then he will send the clients to me for manual lymphatic drainage of the breast after that surgery. So where can we get educated about the MLD in person, the actual MLD? That is an excellent question. So there's several different training resources. I went through close training. So let me type that in, close training. And if you Google close training, there's also Norton, Eccles, Dr. Vodder School. So those are, and yeah, Close, Norton, Eccles, and Dr. Vodder School are the big four. So these are very good training programs. Especially, I want to share some advice that I was given by a very big owner of a oncology massage training program. I went to an AMTA conference way back when I was a student, and I asked her, you know, I'm thinking I'm an oncology massage therapist. I'm thinking of going to lymphedema class. Which one should I take? And she said, because there's a lot of classes out there that will teach manipulation, the actual MLD technique that aren't these four. But she said, think of what you want to do with this technique that you're learning, and think of who is going to refer to you. And so I was like, oh, I'd love to get, you know, lymphedema clients for ongoing lymphedema care after they have gone through the complex decongestive therapy. And she said, think of who those people that are referring you to, what schools would they know that were a quality school that they would feel confident because you went to that school. So that really narrowed it down to me. And I knew if someone was a certified lymphedema therapist and they were working at a hospital, they would more than likely be going to Close, Norton, Eccles, or the Dr. Vodder School. So that's what helped me to choose mine and what education I had, because I wanted to be able to get the quality education and then be able to use that in my marketing that I indeed am with. I have been trained by Close Training. So for the explant, so an explant is a specific surgery, but in many ways it's like all other surgeries, which is it causes swelling after it happens. So the MLD can help to remove the swelling after the surgery, just like we would do MLD for liposuction or any other type of plastic surgery. So if they've been cut, I like to do the MLD to help reduce the swelling after the surgery. Is there a method to do this without a massage therapist? So you can do self-MLD if you have lymphedema. Your lymphedema therapist will be able to show you the self-MLD practices. And indeed, I teach people in my office how to do self-MLD so they can do the massage on themselves in between their professional massages, whether you have lymphedema or you're coming to me after surgery. So that would definitely be something that you can ask at your next massage, and they should be able to show you for your specific surgery how, or your specific situation, how to do the most effective self-MLD. Right. Did I miss any questions?
I think you covered them all. Oh, yep. Well, do we get a recording of this? Yes. So I'm going to be sending that out in an email with the links that we're talking about today to the presentation and to the class. And I'll also post it in our Facebook group. So you'll have all that. Yeah.
Great. And
Yeah.
thank you so much for coming, Craig. Thank you, Amy. I see Amy is here. Amy's went to school with me. So hi.
Good morning. So good to see you. Your hair looks fabulous.
Yes.
I like it curly.
Thank you.
Yeah, so this was great. I've had a lot of really great success with MLD so far, working with CRPS patients. And it's kind of cool, like working with somebody who's never experienced it, or having receiving it for the first time. It's yeah, there's some really good pain relieving effects that it has, especially for people with chronic pain. So it's really nice, and I'm really intrigued to start using this for people that I see with digestive issues, because this is something that I hadn't even occurred to me. Like, of course, that makes so much sense. So I'm looking forward to seeing some of my patients with digestive issues and yeah, using this for that. So yeah.
Wonderful. Yep. And I see Glenn here as well. Glenn comes, I have a office hours on Clubhouse. Hi, Glenn. And he comes to my office hours. I have office hours on Clubhouse every Friday. So if you sign up for the MLD class, you'll get my newsletter. And if you get my newsletter, you'll get the link to the office hours that are for my students on Clubhouse. And then you can see me and 90% of the time, Glenn. And this is a great opportunity if you have questions about post-plastic surgery MLD. As a therapist, you can ask it to a group of people who are also doing that kind of like niche. So we're all in the niche together, and I like to bring people together, because more times than not, we're alone in our offices, just me and the client all week, without colleagues. So that Friday Clubhouse meeting is a way for us to have colleague time and sharing time. So yeah, thank you so much.
Hi, Kathleen. Hi, everyone. Thank you. I'm Glenn. I'm from the San Francisco Bay Area. So yeah, I enjoyed this the Zoom meeting. So thank you.
Yeah, you're welcome. Great. Are there specific techniques or focus areas to use for digestion and depression stress related issues? Yeah, and we're getting to some specifics of MLD, and I encourage you to look at further continuing education classes and the people who are using it for digestive or depression stress related issues. I have my classes are focused more on plastic surgery recovery. So if you look, most of my classes that are continuing education are in that kind of niche. And I would it would be great to also see classes on how people have used MLD for digestive or stress related issues. So there's a lot of, and if there's not one out there and you're an expert in it, I really encourage you to join me as a teacher and start teaching continuing education classes so we can all educate each other.